Hello and welcome to AYU-Well. In this episode of AYU-Well for UK Health Radio, I'm going to be talking to you about how we can look at our nutrition and lifestyle, especially if you are planning to support fertility. It's not uncommon at all in my practice to see couples who have been on their journey to conceive, and despite their hormonal profile, their reproductive tests, both male and female, being of no significance in terms of any abnormalities, yet would have difficulties in conceiving. And this is what, generally we term as sub-fertility. It's not necessarily infertility, but sub-fertility. It doesn't surprise me considering the amount of stress that we experience in today's life, not to mention the stress that is there because of the kinds of foods that we eat, our environmental factors. It's not just the psycho-emotional stress, which is a very major part, but also the stress, physiological stress that's induced due to less than optimal food and lifestyle. So if you are one of those, or if you have friends or you have relatives who really are wanting to conceive and they have been facing problems, then this episode might give you some good direction as to what aspects of our nutrition and lifestyle may be supported in order to increase the chances of conception. Obviously, if you are looking at sub-fertility or infertility, you would have to go and see the right healthcare professional to understand the cause for sub-fertility or infertility. And once that cause is detected and once the right course of action is being determined, despite of doing conventional or fertility support treatments, there is a great value in integrating nutrition and lifestyle to enhance the possibilities of conception. We must not forget that conception is a natural process. Obviously, nature knows how best to do it, provided we increase all opportunities within our environment to enhance that possibility. In about 40% of couples who are not able to conceive easily, the problems usually affecting the male partner is what may constitute to sub-fertility or infertility. In fact, it also might be important to know what infertility is. Infertility is usually defined as failure to conceive after a year or more of regular sexual activity during the time of ovulation. And it may also refer to inability to carry a pregnancy to term. In fact, millions of couples who are in their reproductive age, who are trying to conceive, seem to go through difficulties in conception and also carrying pregnancy to term. So it is a very prevalent problem per se in our modern society. There are many factors, which can affect or which can be the cause for infertility. It depends on ovulation, fertilization, the journey of the fertilized egg through the fallopian tube, and finally into the uterus, and where it is impregnated, and the ability of the hormones in the female's body to support the continuation of pregnancy. There are many factors. In fact, for women, the most common cause of infertility includes ovulatory failure or a defect in ovulation. And there also can be other causes like blocked fallopian tubes or endometriosis, or even uterine fibroids can result in infertility or sub-fertility. And other hormonal conditions, such as polycystic ovarian syndrome, which usually is diagnosed fairly early in the 20s or 30s in a woman's reproductive cycle. And polycystic ovarian syndrome can also result in some ovulatory issues, which results in subfertility or infertility. Very rarely, some women, they may develop antibodies to their partner's sperm, and this can affect in infertility. We also must take into consideration the effect of sexually transmitted diseases on infertility. For instance, chlamydia, which is a sexual transmitted disease, which millions of women and even men do get affected by chlamydia, and this also can result in infertility or contribute towards acting as a risk factor towards infertility. I cannot emphasize enough the effect of psychological issues, such as stress or even fear about parenthood. These may contribute towards infertility. Although it would be wrong to say that, fear about parenthood can result in infertility. Usually it is the stress of infertility which worsens the situation. And about 41% of infertility cases are due to abnormalities in the sperm. So where there can be some dysfunction in the male partner. And the most common reasons are that couples may not be able to conceive easily, or if the woman has endometriosis, obviously, in which case the woman would have to see a gynecologist and have it treated, or use natural methods by seeing a good functional medicine practitioner or a qualified Ayurvedic practitioner or a qualified complementary medicine practitioner who might help them in addressing endometriosis. But an integrative approach would be far better than just following any one particular modality in most cases. And a man may have abnormal sperm, or abnormal sperm as in the morphology or the structure of the sperm. There could be a defect, which is common, but the more common ones are low sperm count or a problem with motility or the strength with which the sperm can swim up the vaginal passage to get into the cervix and then the uterus to be ready for fertilization. Usually, sometimes ovulation can take place irregularly in some women. And so when there are ovulatory abnormalities or disturbances, that also can cause infertility. If the couple are unable to have a complete or a full sexual intercourse, that could be a very simple reason why conception may not happen. Sometimes the cervical mucus, it can attack and kill the sperms. Cervix is the part of the uterus, which is at the lower part, which projects into the vaginal passage, and the mucus in the cervical region, if it attacks the sperm, then the sperm cannot successfully swim through and meet the egg to result in fertilization. I also have seen in many cases where there could be a deficiency in progesterone production in women, which may result in not having enough progesterone to carry a baby to term, resulting in repeated miscarriages. But of course, these causes can now be very easily detected if you have a good doctor, if you have a good gynecologist. It is not difficult to detect these causes should they be resulting in infertility. And we must not underestimate the peak fertility age and how the ability for conception starts to dwindle down as age advances, even within the reproductive cycle. For instance, generally over 34, fertility declines rapidly. However, I must say, in my practice, I have seen many who see me in their late 30s and even 40, and it has been an absolute pleasure and delightful experience when they have followed right kind of integrative care for conception by both using conventional approaches as well as by using functional medicine, Ayurveda, nutritional therapy, lifestyle, mind-body practices, that there have been several successful cases. Now, this is where I believe that once we are able to support the goodness within the body and in our environment, body or our human physiology can do wonders, and therefore it has to be looked at from a very comprehensive, holistic perspective, as opposed to just looking at it as a mechanical issue or just as a pathological issue. Sometimes, if one or both of the members or the partners, if they have had a long-term habit of eating poor diet or poor lifestyle, excess stress, exposure to excessive smoke, all of these, or excessive environmental toxins, heavy metals, they also can very greatly affect fertility. Why I'm emphasizing on these factors is, before we jump into thinking, okay, when you say that you are planning for conception, obviously your friends, your family, those who are your well-wishers, if you do share this desire with them, they might start to suggest various things to say, this is going to help and maybe you should try this. Or some might actually say, okay, if it is not helping you, then go straight into IVF or assisted conception. And this can cause a lot of pressure amongst couples. And I've seen this in literally every case where I have been supporting or have supported couples who are trying to conceive. What is important is to follow certain very simple rules, which are healthy diet, good routine, good sleep, good exercise, ways to manage stress, and to be positive, to be hopeful, not to give up, and to work towards creating the best opportunity for conception. Some of the key lifestyle factors that I would say which you should be looking at if you are planning on conception is to really reduce. Even better is to avoid alcohol. Particularly in men, if there is excess consumption of alcohol, this can reduce sperm count. And in women, if there is excess consumption of alcohol, it can prevent implantation of fertilized egg in the uterus. So both in men and women, excessive consumption of alcohol is something that really needs to be addressed should you be planning for conception. Also, many times I have noticed that those who are trying to conceive, especially the female partner, would be experiencing thrush or vaginal thrush, which is a fungal infection, and therefore they might be excessively douching. And in fact, for conception, the habit or practice of excess douching also appears to reduce fertility. So you really need to speak to your healthcare professional. If you are using vaginal douching, what is the purpose? How long should you use? And when you should stop using it, should you give yourself the best opportunity for conception? And also not taking too many over-the-counter pharmaceutical medications or over-medication in general can inhibit conception, or most of the times it can be really dangerous to the fetus, even if there is pregnancy. So these are factors that we really need to pay attention to. And of course, we all know that smoking can be one of the worst risk factors, which is going to result in low fertility and also can be dangerous to the fetus. To stop smoking and even avoiding secondary smoke would be essential in supporting good fertility. And, when it comes to diet, of course, if there is excess weight or obesity, then to actually reduce weight would greatly help. But let's say if weight is quite average and normal, and that's not a problem, and yet it is important to pay attention to more plant-based diets. Yes, of course, one would need a good amount of carbohydrates, proteins, and fats, but we do know that for infertility, it would not be good to have the practice of eating fried foods or excessive animal fats, sugar, or even junk foods. So these have to be really eliminated from one's diet, both the male and the female partner. And, to incorporate some good practices of eating essential fatty acids, which are very, very useful, like seeds and nuts, and seeds like pumpkin seeds particularly would be very good for men. And also there is evidence that, if you can incorporate bee pollen into your diet, that can help. But be careful that, some may actually have an allergy to bee pollen, in which case you shouldn't really be having it. In many cases where I have seen that all their fertility tests, they come all right, their ovulation is okay, their follicular phase, the luteal phase do not seem to have problems, sperm count is fine, there are no morphological abnormalities in the sperm motility is good, and yet conception won't be happening, I would look at one, possibly the amount of stress that they may have. And when stress is also addressed and conception is still not happening, then there is value in investigating the possibility of heavy metals. Because, this is something that we usually don't think of. But often I suggest to my patients doing a 24-hour urine collection, in the sense, over 24 hours, and to send that urine for a comprehensive element analysis, where we can look at all the various elements like mercury, heavy metals, and also other minerals, lead, mercury, cadmium, aluminium. And it's very interesting to see in how many cases there will be elevated levels of these heavy metals, and in which case it becomes important to chelate heavy metals. And this can be done either through following a conventional method, but that's usually not necessary if the levels of heavy metals are not too high. But it can also be achieved through natural methods, by taking these couple or that person through natural methods to encourage detoxification. There are such wonderful foods such as spirulina, chlorella, there is barley grass, wheatgrass, or chlorophyll, cilantro, which when used on a regular basis can really help in slowly getting rid of these heavy metal toxic load. That may not just be enough, but then we may have to use something like a modified apple pectin or modified pectin with arginine. Some of these nutrients can greatly help. Garlic, and why not go and see an Ayurvedic practitioner who might take you through an Ayurvedic gut cleanse, which is called Virechana, which is one of the key interventions that's used in Ayurvedic cleansing and rejuvenation. And this can also help in creating a better gut health, in possibly reducing heavy metal risk. So when you go on this journey of wanting to conceive, it would be important really to create a good environment within your body, in your gut, in your mind, good nutrients, stress management, and that will give the best opportunity for conception.
UK Health Radio, the station that makes you feel good. UK Health Radio, the station that makes you feel good.
You might wonder, when did supporting fertility or infertility became known to us as a way of specialization or intervention? And when I really look at medical literature, particularly if I go to ancient medical literature, because I was, as a child, trained in one of the world's ancient languages called Sanskrit, which forms the basis of many of the Indian languages. And when I was studying health sciences and medical sciences, that I took great interest in Ayurveda. And one of the classical medical textbooks in Sanskrit, which dates back to 600 BC. Can you believe that? Called Sushruta Samhita. And Sushruta is considered the father of modern surgery because many of the techniques such as rhinoplasty, which have been described in the 600 BC textbook in Sanskrit, is still inspirational, and aspects of that has influenced modern surgery. So you can imagine that supporting fertility was explained or is explained in this very ancient textbook in Sanskrit called Sushruta Samhita. And I am so fascinated by how even at that time there was an emphasis on supporting fertility, although fertility or conception is a very natural process. But I can imagine that maybe if we are looking at thousands of years ago, because the lifestyle may not have been this easy, food would not have been this easily available, and the life expectancy was not at all anything compared to what we have now, and also the number of complications during pregnancy, during childbirth, we can just imagine how important conception, fertility, healthy childbirth, healthy progeny were given importance during those times. And in this textbook, Sushruta Samhita, there is a particular verse. Sushruta Samhita has several sections, and there's one particular section which is called Sharirasthana, which is about embryology, and it's about embryology and development of the fetus and childbirth. And there, in the very first chapter in Sanskrit, Sushruta Samhita, a verse beautifully describes 4 key factors that are necessary for conception or for fertility. And Sushruta, he gives a very beautiful metaphor. He says that if you are thinking about healthy conception or supporting fertility and pregnancy, then you must think of it like the 4 factors of the soil, the seed, the season, and the water. And he uses these Sanskrit terms, which I will share with you, and they're beautiful. Ritu. Ritu in Sanskrit means the season. So when it is the right season. Kshetra, which in Sanskrit means the land or the field, or let's say the soil. Bija, which in Sanskrit is the seed. And this refers to both the sperm and the ovum, the egg and the sperm, the seed. And ambu, which in Sanskrit means water or the nourishing fluid. So what Sushruta says is that much like for a plant to erupt from the earth and to grow into a seedling, a plant, and then a big tree, how the quality of the earth or the soil, the quality of the seed, the season in which it is sown so that germination is possible, and the water which acts as the nutrient or the fertilizer, these 4 play an important role. Similarly, when it comes to conception, all of these factors are important. So Sushruta, in his advice on how to support fertility, he addresses both men and women. And then he refers to how it's very important, even before the seed is sown into the soil, to prepare the ground or the earth to be fertile, and then to have the right kind of nourishment in terms of the fertilizer, and it should be the right season. And this biologically hasn't changed at all, because it's so important that conception is attempted at a time when the ovulation is at its peak. And fortunately, today there are very simple and perhaps, less expensive or reasonably priced tests that you can do even at home to understand when is a good time to have sex so it can result in conception. And you may know that, there are two phases in the menstrual cycle, the follicular phase and the luteal phase. From the day of menstruation to when the menstruation stops, from the day of menstruation, that's the follicular phase. In a cycle of about 28 days, let's say, it can vary from 26 to 31, sometimes even 40. But of course, I would expect in my practice that a woman who is wanting to conceive has an average of about 28 days to 29 days cycle. And when we look at 28 days, then first 14 days, we are looking at the follicular phase, and the next 14 would be the luteal phase. It doesn't exactly divide like that, but it's around that time. But then it's somewhere between the 12th and the 17th day, usually is when ovulation takes place. But then which of these days is the best time to have sex is something that now is possible to detect through urine strips. You can look for fertility testing kits, home kits, where these urine strips, they can actually measure the luteal hormone and the estrogen, and then indicate which is a day where actually ovulation is at its peak. And that would be a good time to have sex in order to conceive. And I usually always also tell the male partner that it would be good to focus on the female partner's ovulation time. And now you get even these digital monitors which actually indicate, okay, today, every day, okay, today is not the day to test. Today you test and it shows, okay, yeah, this is peak ovulation. But then once you are able to estimate that, if the male partner is able to be abstinent for about 2 to 3 days, I would say about 3 days, actually the quality of the ejaculate after about 3 days of abstinence is found to be really of good quality. So it will have better sperm quality. So if the male and female partners, they both kind of plan and participate in supporting their fertility naturally, it becomes that much more easier. And so these analogy that Sushrita not only gave analogy, he also has mentioned various lifestyle and nutritional changes that the couples would have to make, which is described in Ayurveda and still practiced in traditional Ayurveda, but in a more modern way, that nutrition lifestyle can play an important role in supporting fertility.
UK Health Radio, the station that makes you feel good. The station that makes you feel good.
As you have heard, there are many considerations to make when it comes to supporting fertility. Because there are so many causes, there are so many different risk factors or factors contributing towards good fertility, it's very important for me to also emphasize that the role of investigating or the role of understanding the health status, particularly reproductive health status of the male partner. Because in 40% of all cases of infertility, it's usually the defects in the sperm which contributes towards infertility. And this could be related to various aspects, such as, varicocele, which are sometimes, they can be treated through surgery. And once the varicocele are treated through surgery, then fertility becomes possible. But I've also noticed in my practice that although sometimes these varicoceles are identified and they are treated through surgery in men, that it may not exactly be the one which is the only cause which would have been contributing to infertility. So taking a holistic approach becomes important. Also, long-term use of pharmaceutical medications or even, improper use of over-the-counter pharmaceutical drugs can all actually reduce the chances of the sperm having a good quality. It's also important to emphasize that, many over-the-counter products, particularly these antacids, they may actually decrease sperm count and even produce impotence if it is taken for too long in dosages that are excessive. What can a man do in order to improve their sperm quality? What is interesting is many case studies, and also there is anecdotal knowledge of how going on a complete gluten-free diet, it can enable some previously sterile men to become fertile. And also, gluten-free diet can be of great value in women to support with pregnancy. So, doing some very simple elimination like removing gluten may work the wonder, provided you also have considered all other causes. And I must also mention that, use of recreational drugs can be one of the major problems. It is become quite common in urban settings, and that can also affect fertility. So it's important to remove these kinds of toxins from one's lifestyle at least a few months before planning conception. It is also very important to consider some of the nutrients which play an important role in supporting fertility. For instance, vitamin C, vitamin E, zinc, and B vitamins, they are all very helpful. Whether you are getting these vitamins from your food or if you are consulting a good healthcare professional who can advise you on these nutrients, that can be helpful. For instance, vitamin C, it's really important in sperm production. It keeps the sperm from clumping, and it makes the sperm more motile. So having good citrus fruits, or even, having the Ayurvedic combination of Triphala, which contains amalaki, which really helps with vitamin C, or taking a good quality of vitamin C by consulting a qualified healthcare professional. And zinc, zinc is important for the functioning of the reproductive organs. And zinc is found in very high concentrations in the semen. So zinc is an important nutrient. And so is vitamin E, because vitamin E, it's needed to balance hormone production. And it's been known as the sex vitamin that carries oxygen to the sex organs, and it increases sperm count. So taking vitamin E under the guidance of a nutritional therapist or a functional medicine practitioner would be of value. And many of you may have heard of the importance of selenium, because selenium our soil lacks selenium. We generally have selenium deficiency because we are not getting it enough through our food. And this deficiency, it can lead to reduced sperm count, and it's been linked to both infertility in men and infertility in women. So selenium, you might be thinking, what can I have in terms of food if I'm not wanting to have selenium as a supplement? Nuts, Brazil nuts. I absolutely recommend Brazil nuts to many of my patients just as a very good nutrient because it's rich in selenium, and you can get into the practice of just like crushing about 3 Brazil nuts and mixing it with plant milk, or if you drink dairy milk, as long as it's of good quality, you can just warm it up. You can add some saffron, some cardamom, cinnamon, make it into a nice drink with plant milk or regular milk and some crushed and activated nuts or nut powders. And this, if you can have it on a daily basis, I usually recommend that have it before going to bed because these are rich in tryptophan that can convert into serotonin, which also will help in better sleep, better relaxation. So this can all be very helpful. And sometimes I also find that neurological stress and excessive sympathetic activity because of busyness, because of doing too many things in life and stress, not sleeping well, excessive energy expenditure. In these situations, taking a good vitamin B complex can be of value, particularly, vitamin B, vitamin B6, and vitamin B12. These can be really helpful because vitamin B12, both folic acid and vitamin B12, they can actually protect the egg, they can improve the quality of the sperm, and they can maintain fertility. And vitamin B complex in general, it's really important in reproductive functions. So do talk to a good nutritional therapist, and if you can use some of these nutrients, that can help with improving chances of conception. What else would you be looking at? Omega-3s. As I said, in the earlier part of this episode, that essential fatty acids. And these essential fatty acids, because they regulate normal glandular function and especially the reproductive glands. So having a good source of omegas. So you also have to pay attention to when you're taking omegas if it is contaminated or can have high mercury, because mercury is no good, or mercury contamination when we are thinking of fertility. So do source a good source of omega and have these omegas. Now, I can't emphasize how important it is to have a variety of seeds and oils, flaxseed, linseed, sesame seeds, to incorporate them into everyday diet, to have olive oil, to have sesame oil, to have coconut oil, and even to use clarified butter or ghee. These, when they become part of one's daily lifestyle, we can expect omega-3s to become more easily available and abundant. And if we are particularly looking at improving sperm quality, in men, then we should also be looking at essential amino acids. Many men, who go to the gym, who are very sporty, athletic, would know about BCAAs. So which are the branch chain amino acids, leucine, isoleucine, and valine. And these are often used either as pre-workout or even post-workout for better recovery. But these essential amino acids, they also help in better quality of sperm. But particularly for sperm, it's L-arginine or L-cysteine, L-methionine, L-tyrosine. These are the amino acids which have shown to have good evidence in supporting fertility. And obviously, when I see patients who come to see me for sub-fertility or infertility, that they often ask me about herbs. And when it comes to herbs, I would not just recommend take these herbs, because I think it would be irresponsible to say that if you take this particular herb, you can have greater chance of fertility. One would really need to consult a qualified healthcare professional who understands what these herbs do, whether there are any interactions. But in general, what we know is astragalus, astragalus extract, it's been reported to stimulate sperm motility. And other herbs like ginseng, sarsaparilla, salt, palmetto, gotu-kola, licorice root, wild yam, these have shown good effects to support fertility in women. But do consult a healthcare professional before you start any of these, because some of them may not be useful or can be harmful if there are other conditions. For instance, ginseng or licorice is not really advisable if one has high blood pressure, and so you have to be also careful when you use them. Then the herbs that I certainly can say which you should not be overusing, or maybe even you want to avoid if you are planning for conception, or echinacea, ginkgo biloba, St. John's wort, as they have shown to cause subfertility in men. However, if you're seeing a qualified herbalist, they might be able to give you a better advice whether to have some of these or not, or how to take them. So overall, what I'd like to share with you is that fertility or sub-fertility, we don't have to always immediately think of assisted conception or IVF, although in many of the cases that I see, I do support them through complementary approaches or integrative approaches while they're going through that. But it's important to clean up our diet, clean up our mind, get good nutrients, have a good stress management system, and make sure that there is no heavy metal toxicity. And once all of these are addressed, then that would create a good foundation for optimal chances for conception. I hope, this information has been useful for you, especially if you are looking at conception or you have somebody that you may want to share this information with them. And thank you so much for listening to AYU-Well. I'll be talking to you again next week on another topic for UK Health Radio on AYU-Well. Thank you.